the MP Skills Made Easy team, and we're glad to have you as well.
All right. And of course, I'm Dr. Oji. And of course, I am the lead clinical instructor for MP Skills Made Easy. So I'm really excited to have everyone join.
We can start with a few icebreakers. Can we have everybody who's participating to drop their name, where they're from, and also your specialty in the chat? We'd love to see who we're on here with.
Can everyone hear you? Can everyone hear? Okay.
Yeah, we have somebody. It
Okay.
says Valerie from Texas. Hi, Valerie. Nice to have you. New grad. So that's good to hear.
Okay.
Kemi from Canada. Wow. Okay. Nice to have you, Kemi.
Hi. Wow. What part of Canada, Kemi?
Oh,
Saskatchewan. Wow. Very nice. Wow. So how did you hear about this? I'm always curious to find out. How did you hear about the webinar? Hmm.
okay. We have a cardiology NP from Philadelphia named Yelena. Good to have you here.
Very nice. Very nice. Welcome, everyone. Welcome. Welcome. Make sure you text a friend to join as well. Sometimes folks forget, so send a quick text to say, okay, well, we're 6 minutes away from joining and starting out, so you definitely can invite a friend. Okay.
Kemi says she heard about the webinar from her email.
Oh
So
wow.
that's
Okay.
lovely. That's lovely.
Mm-hmm. It's pretty cool. Very nice.
Kemi, you didn't mention your specialty. So what is your specialty also while we have you here? Urgent care. Okay, that's exciting. That's exciting.
Nice.
Cool. Yelena found us from Facebook. Okay.
That's really good.
And Valerie, what about you? How did you hear about us? Krista Schneider, we also haven't heard from you either. Would love to hear from you as well. Valerie says she registered for the Skills Shop in Austin and then she got an email. That's lovely.
Very nice. Well, we look forward to having you join us in Austin, Valerie. Very nice. Very nice. So, where are you hoping to work? Are you hoping to go into urgent care or primary care? Have you gotten a job yet, Valerie? Hmm. No, I hear you. Especially with a new grad, but I believe the skills workshop would definitely help, and you definitely want to add that to your resume as well once you're done with it to show employers, the skills that you're able to bring to the table. But yeah.
Mhm. I see we got a few new people joining us. Donna Rivera, Suzanne Tuck, Regini. Good to have you guys here. We're just doing a few icebreakers. Drop your name, where you're from, and also your specialty in the chat. We're glad to have you guys this evening.
Yeah. Welcome, everyone. We have a few more minutes before we get started. So if you're just joining, feel free to add your name to the chat and, of course, where you're from and your specialty. We just want to welcome you. Very nice.
Hello. We have Donna saying she's from Nevada, specifically from Pahrump, Nevada, doing primary wound and weight loss. So that's interesting. It's good to have you here, Donna. Thank you.
Very nice to meet you, Donna. Thanks for joining us.
Oh, and we'd also love to hear how you guys heard about the webinar, what brought you here, like which avenue that you saw the webinar from. We would love to hear that as well. So as if you're just joining us, go ahead and put your name, where you're from, and your specialty in the chat. And also, if you can, how you heard about the webinar. Okay, Donna says she's also coming to the Austin Skills Workshop, so that's lovely. And she received an email. And then Romil is saying hello. They are a NP from Dallas. Love to see it.
Very nice. Welcome, everyone. Welcome, welcome. Donna, so you do primary care and wound care, okay? And yeah, we look forward to having you join us for sure in Austin. And Ramil, what's your specialty, Ramil? If you don't mind sharing with us.
Suzanne is also saying hello from Texas. FNP doing on-site care and primary care.
Okay.
And Romil also mentioned primary care as well.
Very nice. Very nice. Oh, very nice to meet you, Ramel. So yeah, it looks like we're on top of the hour, so we're just gonna go ahead and get started. Welcome, everyone. Make sure you send a quick text to a friend to join, someone that you know would benefit from this webinar as well. Okay. All right, so I'm just gonna go ahead and share my screen and let's get this party started.
Hi, everybody. My name is Amelia. I am a part of the NP Skills Made Easy team, and we just want to again say thank you so much for being here, spending this evening with us. Tonight's webinar is about medical weight loss, and so we will dive right on in. Starting with our introduction of speaker. Tonight's presenter is Dr. Oji. She earned her master's degree at University of Texas Health Science Center in Houston and her doctorate from Duke University in North Carolina. She is currently a family nurse practitioner. She applies her extensive simulation education background in the classroom to teach excellent and precise hands-on skills. Her passion is helping advanced practitioners and students build confidence in learning procedures and clinical skills. She is also a follower of Christ, and her worldview is based on biblical principles.
Thank you so much, Amelia, for that wonderful introduction, and welcome everyone. I'm really excited about tonight.
Now we'll share a little about who we are and what drives us. Our vision is to revolutionize advanced practitioner continuing education by providing excellent, useful, and accessible educational content, always leading with integrity and a passion for excellence. Our mission is to empower nurse practitioners, physician assistants, and striving NP students to learn concrete, relevant procedural skills to practice confidently in any healthcare setting.
Now, a quick disclosure before we move forward. This webinar will be one contact hour if you do reach the completion of it. In order to gain that contact hour, you have to have attendance for 100% of the activity, as well as be participating, answering the multiple choice questions, completing the poll questions, and just attending fully. We must also mention that there is no relevant financial relationships that were identified for any individuals with the ability to control content of the activity. And lastly, our approval statement, NP Skills Made Easy Workshops is accredited as a provider of nursing continuing professional development by the American Nursing Credential Centers Commission on Accreditation. So that's just a little legal talk to get out of the way, but we will move right on ahead. And before we get started with the webinar, we do want to ask that you reduce any distractions that are around you. Again, this is going to be very interactive, very fun. So we want to make sure that you're participating, make sure that you're answering questions, that you're feeling engaged. You're going to learn a lot tonight. So there will be a question and answer session towards the end of the presentation. So please make sure you're writing down your questions, writing down notes, and make sure that you let us know any questions that you might have. Of course, at the end, we will also let you know where you can get more info on what we touch on today, as well as some of our other courses. And if you stay until the end, you get your CE credit. So without further ado, we will go on right ahead to our first poll.
Yes, now that you know a little bit about us, we'd love to learn a little more about you. Let's start with this poll on why you're here today. Are you an NP grad or transitioning into clinical practice and will need foundational principles of medical weight loss management? Or are you an experienced NP but aren't quite familiar with current medical weight loss treatment options and guidelines? Or do you have experience with medical weight loss management but would love to enhance your knowledge and skills in this area? If you can put your option in the chat. I see some new NP grads, some who are experienced and would like to know more. Well, we welcome you all, and we hope that you find everything you need and more in this webinar. We're glad to have you here.
Very nice.
A few questions that we want you to ponder over as we're going throughout this presentation. Question 1, how confident do you feel in managing patients with obesity using current evidence-based guidelines? Question 2, are you aware of the latest pharmacologic and non-pharmacologic treatments for medical weight loss? Question 3, do you feel prepared to counsel patients on sustainable dietary, behavioral, and even lifestyle changes? And question 4, how familiar are you with identifying and addressing medications that contribute to weight gain? As you're pondering over these questions, we also want you to realize all of the things that you're going to learn today. So today we will be touching on obesity as a chronic disorder, caloric deficit recommendations, semaglutide and liraglutide effects, pharmacotherapy options, new generation obesity drugs, the role of the advanced practitioner, the dietary and behavioral strategies, as well as bariatric surgery considerations. So there is a lot to learn today. And without further ado, we are going to shift over to our goals.
Yes, our goals are to teach you medical weight loss management principles that will greatly impact your patient care so you can make informed, evidence-based clinical decisions moving forwards. Also, to provide you with the valuable resources that will simplify your learning and application of medical weight loss strategies in clinical practice.
All right. Well, thank you, Amelia, and thank you, Kiana, for that wonderful introduction. But I'm just going to start off by talking about obesity as a chronic disease. So a couple of things that you want to know as an advanced practice provider is that obesity is actually a chronic disease and is linked to several health conditions like your type 2 diabetes, your non-alcoholic fatty liver disease, pulmonary and cardiovascular disease. So again, essentially your metabolic syndrome typically would be related to obesity. So the treatment guidelines recommend your patients losing at least 5 to 15% of their body weight to improve the cardiovascular and comorbid conditions that we talked about, such as your type 2 diabetes and cardiovascular disease. So again, your job as a nurse practitioner is to make sure that you're, incorporating this with every visit, making sure that you feel comfortable talking about obesity and really talking about guidelines on how patients can reduce their body weight. Again, that would typically reduce the health conditions we mentioned earlier. And then, of course, knowing that managing obesity requires a comprehensive ongoing approach is not just a one-time fix all. It has to be an ongoing approach to say, okay, well, how can we work together as a team to help you lose some weight? So the concept of caloric deficit recommendation. So again, this is something that you definitely want to keep in mind in terms of, the daily caloric deficit that the patients would need to really promote weight loss. So in this case, the patients would need to lose at least 500 to 750 calories for them to promote weight loss. Again, how can this be achieved? Again, your job is really to talk about this patient's diet. You want to be able to create an atmosphere in your clinical practice where the patient feels free to discuss with you. Feel free to talk about what their diet comprises of. Do they eat fast foods, or do they cook at home? And really, what about their exercise and lifestyle modification? And then, of course, the exact calorie goal would vary based on the patient's gender and their baseline body weight. So again, one of the recommendations that you want to keep in mind would be that a gradual calorie reduction does support a sustainable long-term result. So again, just putting the patient on a crash diet and expecting, yeah, they're going to lose the weight, but can they sustain that weight loss? And that's really important for you to also talk about with the patients.
And now we have our first question of the evening. A 28-year-old male patient is seen in an outpatient clinic for a follow-up visit. The advanced practitioner reviews his weight loss goals and determines that which of the following weight loss goals are both realistic and achievable. Number 1, prevent further weight gain. Number 2, keep weight stable. Number 3, 10% body weight loss yields improvement. Or 4, all of the above. So which of these options are both realistic and achievable weight loss goals? You can go ahead and respond in the chat with the number 1 through 4. Okay, I'm seeing quite a bit of answers. Ones, I'm seeing 3s, a couple 2s, some 4s. So yes, if you put 4, that is correct. The actual answer is all of the above. So all of these are both realistic and achievable weight loss goals.
All right. So moving forward, we're just going to talk about your semaglutide and liraglutide effects. And so for those of us that are new grads in the room, again, we all remember that I teach at the university and I teach nurse practitioner students. The reason why I felt this was going to be really important to talk about would be, in clinical practice, seeing students not really knowing the difference between, let's say, your Wegovy, which is a semaglutide, versus your Ozempic, which is for type 2 diabetes. So you want to make sure that you have it clear in your mind that Wegovy is specific for weight loss, and your Ozempic is specific for type 2 diabetes. You don't want to have to give a patient who is trying to lose some weight Ozempic because, again, it's FDA approved for type 2 diabetes. Okay. So again, semaglutide, which is Wegovy, and liraglutide, which is Saxenda, they both induce weight loss by lowering energy intake. Semaglutide does reduce your calorie intake by about 35% compared to your liraglutide. So again, Another good thing about semaglutide that you want to know would be that it does help reduce food cravings. So some of your patients will come in and they tell you that, okay, well, yeah, they're able to get through the mornings without, snacking or, eating fast foods or what have you. But after that 4 p.m. slump, it's almost like, okay, well, I really need to eat something. So again, semaglutide would definitely help with the food cravings. But again, your job would be to say, okay, well, there are some healthy food options, snacks that might also be helpful for the food cravings. But again, it's just good for you to know. And then, of course, Zepbound, which is tirzepatide, that's a GLP-1 receptor agonist, is another option for the patients that, maybe their insurance may not want to approve your Wegovy. See if they can approve the Zepbound. So that's another alternative for these patients. So I'm just going to talk in general about your medication side effects. So again, this would be specific to your semaglutide and your liraglutide. So GI side effects like your nausea, vomiting, gastroparesis. Some patients would actually complain that they feel so full that they don't want to eat anymore. But remember that this is part of the mechanism of action of the medication. So again, nausea, vomiting does occur in about 84% of patients who take semaglutide. And, again, very similar, 83% of patients that take your Saxenda, liraglutide, would complain about some GI side effects. So again, how to mitigate this is really to start at a very slower or lower dose. So again, making sure that you're not quickly increasing that dose, because once you get to the max dose, most of your patients would definitely have that GI side effects. It's also important to prepare these patients for this possible side effects before starting treatment, and just letting them know that the GI side effects is real, and they would feel a little nauseous, and they can have some vomiting, they can have that feeling of fullness. In practice, we actually had some patients that had to go to the ER because they were diagnosed with gastroparesis related to the GLP-1s. So that's something that you definitely want to keep in mind, and not increasing that dose very quickly would help you to stabilize the patient. So these are some studies that showed some weight loss with semaglutide. So again, weekly semaglutide injections with diet and exercise. And of course, the patients would typically have more weight loss at 68 weeks than your daily liraglutide. So semaglutide definitely is a better medication, pharmacotherapeutic for weight loss. But again, it depends, because some patients' insurance may not cover, and you may want to, try out the liraglutide and see how the patients do with that, of course, and if their insurance will cover that. And then, of course, this research studies show that the semaglutide does benefit. It demonstrates the benefit of once weekly dosing combined with lifestyle changes. I couldn't tell you how many patients in the clinic that I've seen that they come in, they just want a refill of a medication, and you're talking about lifestyle changes, and they're really not wanting to exercise, they're really not wanting to eat better. Again, it's your job to make sure that you're really telling this patient and setting expectations that, yeah, the medication alone is not going to help you lose weight. You still need to exercise, you still need to diet, you need to watch, do your own part, and then the medication would just enhance what you're already doing. All right, I'm going to switch gears and talk about pharmacotherapeutics and some options that you have there. So remember that, like I said earlier, the GLP-1s are pretty expensive. Most of your patients' insurance, they would want for you to start, try something else before approving the GLP-1s. So medication approved for adult obesity would include semaglutide. We talked about that already. The tirzepatide, your liraglutide. Orlistat is another one that, you can try, with this patient, and we'll talk about that, more detail. Phentermine is another one. Again, remember, phentermine is a Schedule 4 drug. So again, you always have to keep that in mind. It does cause some palpitations in some patients. You want to also keep that in mind. And then, of course, your Contrave, which is your naltrexone, bupropion combination. So each medication has a different mechanism of action, and we'll talk about that, the dosing and the side effects profiles. You want to become real familiar with this as well. So we're going to start out with the semaglutide Wegovy. So remember, we talked about it. That is a once weekly sub-Q injection. So the patients would have to get the shots once a week. The mechanism of action of semaglutide is that it does increase glucose-dependent insulin secretion. It slows gastric emptying and lowers glucagon secretion. So again, the patients, your ideal patients will be patients 12 years and older. You do not want to give it to any pediatric patients that is younger than 12. And so the FDA approved Wegovy for patients with a BMI that is greater than 30 or 27, greater than 27 if they have at least one comorbidity. So again, that could be hypertension or diabetes or thyroid disorder. Again, remember that 27 would be for patients that have some comorbid conditions, and BMI 30 is approved for everyone else. So again, the dose for Wegovy typically would be you starting at 1.25 milligram. Again, like I said, you want to stay at the lowest dose, as much as possible. I've seen patients in the clinic that come in and they want for you to, within a week or 2 weeks, they're like, okay, well, can you increase the dose? So you want to be real careful to tell the patient that increasing that dose to 2.4 very rapidly could increase the risk of the GI side effects we talked about, including gastroparesis. Another thing that you want to think about, some information that you may want to provide on patient education would be, of course, having this patient eat some meals. So again, meals should be eaten at least 30 to 60 minutes before, the dose. Sorry, not before, after the dosing to reduce the risk of nausea, vomiting. So again, remember that nausea, vomiting is something that you want to discuss with the patients. What about some patients with pancreatitis or the risk of pancreatitis? You want to make sure that you're not prescribing semaglutide to this patient. This is really important as nurse practitioners or physician assistants that we know this information. Patients that drink alcohol, maybe substance, abuse alcohol, that could be at a risk for pancreatitis. Be real careful with Wegovy. And then, of course, patients that could have or at a risk for thyroid C-cell tumors. Again, this is a black box warning by FDA showing that this patient would not do very well with this medication as well. So again, it's contraindicated. You do not want to actually prescribe semaglutide, Wegovy in patients with thyroid C-cell tumors. All right, I'm going to move forward and let's talk a little bit about your tirzepatide, which is your Zepbound. So tirzepatide works like semaglutide. How it works is really to increase insulin secretion. It slows gastric emptying. So if you remember that I talked about the side effects, including gastroparesis, and that is really the mechanism of action of this medication. Your ideal patients will be patients 12 and older. And again, this would be the dose. 2.5 is what you really want to start the patient out with. You can increase to 10 milligram and 15 milligram. Be real careful again to quickly dial up to that 15 milligram because of the side effects. Tirzepatide, which is Zepbound, it's approved for similar BMI and age criteria. So we talked about greater than 30 BMI in most of your patients and greater than 27 in patients with any type of comorbid conditions. And then, of course, very similar to your Wegovy, the GI disturbances are also common. Remember that patients with thyroid C-cell tumors or who may be at risk should really not get any of the GLP-1s. All right, we're going to talk a little bit about your liraglutide, which is Saxenda. So again, the mechanism of action of liraglutide is to increase insulin secretion. It slows gastric emptying, and it does decrease inappropriate glucagon secretion. Again, your ideal patient will be patients 12 years and older, and you're titrating this weekly dose every 7 days, okay? So we're starting at 0.6 milligram, and then, of course, we can get up to 1.8 milligram. The GI disturbance is also something that you want to talk about with these patients, and patients should eat a meal about 30 to 60 minutes after the medication. All right, well, I'm going to hand off now so we can do another Q&A.
Yes, let's check your knowledge with a quick question. Which medication is considered a GLP-1 receptor agonist? Your options are 1, Contrave, 2, Xenical, option 3, Saxenda, or option 4, Qsymia. Let's see what you guys are saying in the chat. We're going in with the rolling option 3. And if option 3, Saxenda, was your answer, it is correct. That is considered a GLP-1 receptor agonist.
Very nice. It looks like everyone's paying attention. Very good. Very good. All right, so let's talk a little bit about Orlistat, which is Xenical. So Xenical, it works a little different. It does inhibit the gastric and pancreatic lipase, and it also blocks the absorption of dietary fats. Orlistat should be prescribed in patients who are 12 and older. It should be taken at least 3 times daily with fatty meals, starting at 120 milligram dose. So again, the BMI of 30 or 27 with one comorbid condition is another criteria for starting a patient on Xenical. And a side effects that you definitely want to keep in mind and you want to talk about this with your patients will be flatulence and oily spotting. Again, just remember the way that it works, right? It does block the absorption of dietary fats, and that's why most patients will see that oily spotting with bowel movements. So again, you want to keep that in mind. We'll talk a little bit about your Adipex, phentermine, and phentermine topiramate, so Qsymia, however you want to say that. So remember that phentermine suppresses the patient's appetite through the CNS, right? It has to be going through that CNS effect. We typically will prescribe phentermine in patients with patients who are 16 and older. So again, it has to be patients that are a little older. It's a schedule for a controlled substance. So you want to be sure that you also have your DEA license before prescribing phentermine. And then Adipex doses, so again, phentermine doses range from 15 to 37.5 milligram daily. And then, of course, the combo, which is phentermine topiramate with the Qsymia, the dose range from 3.75 to about 15 milligram. So the way that you want to kind of think about this would be that patients are coming and you're prescribing phentermine topiramate. It does work in 2 ways. It combines appetite suppression with other mechanisms of action. Remember that phentermine does suppress appetite through that CNS system. And then, of course, the topiramate also works in combination with phentermine really to suppress this patient's appetite. So again, it's something that you want to know. And it's dosed weekly as well. We're going to talk about Contrave. So that would be a naltrexone and bupropion combination. The mechanism of action of Contrave is really to combine, and it does block opioid receptors to reduce appetite and cravings. Of course, you're starting at the lowest dose, and then you're going to titrate this over 2 weeks. So 90 milligram / 8 milligram. Remember, this is a combination medication. And then, of course, you want to increase that by 1 tablet a day until 2 tablets every 2 weeks. So in my practice, most patients that talk about craving quite a bit, they do very well with Contrave. This is something that you want to keep in mind. Especially if they cannot afford the GLP-1s. So again, Contrave is an option for your patients. Be aware that Contrave is not suitable for patients with severe liver impairment or patients who have a seizure risk. So again, keep in mind that these patients would not be good candidates for Contrave.
And rolling right on ahead with another question. Which medication works by the inhibition of gastric and pancreatic lipases and can lead to potential oily spotting? Is it 1, Contrave, 2, Orlistat, 3, semaglutide, or 4, phentermine? Okay, I'm seeing twos again. A lot of twos in the chat. If you did say Orlistat, that is correct. So, yes, orlistat is the one that inhibits the gastric and pancreatic lipases and leads to the oily spotting. Good job, guys.
Very nice. Very, very well done. All right, so let's switch gears a little bit and talk a little bit about your newer generation obesity medications. We did touch upon some of those, but we have some newer GLP-1s and newer medications that are in the horizon that you definitely want to know about. So again, semaglutide, we talked about that. It does produce about 15 to 20% of weight loss in most of your patients. Tirzepatide, 15 milligram would produce about 15% of weight loss in most of your patients. Retatrutide is a newer obesity medication. It does produce about 24% of weight loss in most of your patients. And of course, your survodutide does produce about 18.7%, so about 19% of weight loss in most of your patients. So these medications, they target multiple pathways involved in obesity. And so that's why, it's good that we kind of know what's, in the horizon, the ones that are already here and the ones that are making their way to the market, that you become familiar with those as well. All right, let's talk a little bit about your role as the advanced practice provider. So, as a nurse practitioner, as a physician assistant, as a physician, your job is really to review medications that cause weight gain. This is something that some providers would not really think about if they're not paying attention. So, your steroid medications, especially patients that are on long-term steroid use, could cause weight gain. And of course, if they're coming and you're wanting to help them lose weight, then you definitely want to address that and see, could there be an alternative for the steroids and of course your antidepressants. I also want to mention right here that of course patients with thyroid disorders, especially hypothyroidism, you want to keep that in mind that that could be a cause for weight gain, and you definitely want to put these patients on your thyroid medications and hopefully help them lose weight as well. Your other job would be to make sure that you're screening patients with BMI and with circumference measurements, especially if you're wanting to include medical weight loss to your practice. Again, making sure that you're setting realistic goals for the patient that would help to address barriers for long-term lifestyle changes. Because again, if the patient cannot just say, well, I'm getting the medication and I'm going home, if they really don't make the lifestyle changes, they really truly have to make the lifestyle changes. So again, this is a good way for you to, talk with your patients and make sure that you're, following up with the patients once you start them on the GLP-1s or any of the medications we talked about, having them follow up. And this could be, through telehealth or telehealth visits, making sure that you're definitely following up before they titrate the medications upwards. All right, well, I'm going to talk a little bit about some strategies that would be helpful for you. So we talked about the diet, but what about the behavioral strategies? So this is so important as nurse practitioners that we're also addressing the behavioral issues that the patients could have. So again, addressing depression, eating disorders, addressing bulimia, anorexia, also addressing especially bulimia, but also, knowing that motivational interviewing would be really helpful for most of his patients. There's some patients that they just really eat when they're bored. There are patients that eat when they're, angry. All the emotions related with, food. This has to be addressed, very quickly for you to get that sustained weight loss goal that the patient is hoping to achieve. So the behavioral approaches, sometimes you may have to refer the patient out to a psych mental health practitioner if if a patient needs it. So individualizing care is so critical in weight loss as well. And then, of course, we talked a little bit about caloric intake reduction. This is really critical, key, and regardless of the nutrient composition that the patient thinks about, reducing their caloric intake. And the physical activity should be encouraged alongside diet changes. Again, with the physical activity, you'll want to make sure that you're talking to the patient about, 150 minutes of aerobic exercises weekly. They can divide that up, and it doesn't have to be that they're going to the gym. It could just be taking walks in the evening, aqua exercise, going in the pool, So however it is that the patient wants to be physically active, just really encourage physical activity and discuss that with them in detail. All right, so I want to talk a little bit about bariatric surgery, and this would be the last considerations and some topics that we'll talk about tonight. So most of your patients that come in that would require surgery would be patients that have a BMI of 40 or higher. So again, if you're trying to say, okay, well, let's do some of the GLP-1s or all of the other medications we talked about in this patients. Again, you can give it a try, but I would tell you that bariatric surgery should be something that you talk about with the patient. You consider that that's an option for this patient as well. So common procedures that we see out there would be your Roux-en-Y gastric bypass, the sleeve gastrectomy, and your adjustable gastric banding. Again, just knowing in detail a little more about these common procedures and also knowing that lifelong follow-up is necessary after surgery because again, these patients will lack vitamin B12, they would need replacement, but they also would need to follow up with the bariatric surgery periodically.
We have another question for you guys here, so let's work through a clinical scenario together. There's a 45-year-old patient with a BMI of 46 kilograms per meter squared and a history of type 2 diabetes and hyperlipidemia, inquires about bariatric surgery. The advanced practitioner informs her that which of the following procedures involves the small gastric pouch and small bowel reconfiguration with good weight loss outcomes. We have option 1, duodenal switch, option 2, jejunal bypass, option 3, biliopancreatic diversion, or option 4, Roux-en-Y gastric bypass. I'm seeing some option 4s, a lot more option 4s. So if you chose option 4, Roux-en-Y gastric bypass, you are correct.
Very nice. Okay, so we're just going to go ahead and move forward and really just summarize what we've talked about this evening. So obesity, remember that it is a chronic disease that requires a multifaceted treatment option. Combining medications, not just medications, lifestyle changes will be really important. Behavioral support in patients that, that have any type of, cravings or that has to do with emotions. That, combining this three support strategies would definitely lead to the better outcome or the best outcome for the patient. So you as the nurse practitioner, you definitely would play a crucial role in patient guidance and support. And so again, being that person that the patient, trusts, they can talk to about, okay, well, I'm not doing so well with this medication, the side effects, or can we switch out and do something else? Or how can I even start to lose weight? Sometimes you may have to get a multidisciplinary approach, a team to really help with this patient. A dietitian might be important to have talking about the different diets and so forth. So again, just really knowing, that you are the gatekeeper for the patient is crucial.
Since this webinar is just a brief portion of one of our courses that we offer, we want to know what else sparks your interest. We have family practice, or option 2, women's health, option 3, medical weight loss, option 4, urgent care course, or if you have another option, you can type it in the chat. I see family practice, women's health, family practice, HRT. We got a lot of family practice and women's health, primary care as well. The good news is we offer a lot of courses, so a lot of these are covered.
All right. Yeah, and of course, I saw someone, it was a Sunset that said HRT, so that is included in the women's health course as well. So we'll talk about that in more detail.
All right, we've covered a lot. Now let's open it up to you. It's Q&A time. If you have any questions, go ahead and type them in the chat box and we'll do our best to answer them.
And while you guys are formulating those questions and dropping them in the chat, I just want to explain in a bit more detail about our medical weight loss course. Now, this webinar was just kind of a short, brief description of a couple things that you will see. But in our medical weight loss course, it's a more comprehensive learning aspect of it. In the course, you get 10 CE credits as well as 1 RX hour. And you just learn so much. It helps you become a better clinician. It helps you be more confident when you're encountering these patients. It helps you really get into the diagnosis area of it and feel more confident and more boosted in your abilities. If you look kind of closely here on the right hand side, you can see some of the things that are offered in the specific chapters. Some of our favorites are the medical obesity, establishing a medical obesity clinic. And so that kind of dives into how to incorporate these type of practices in your own clinic so that you can make money off of it as well, versus having to refer it out. And then another one is the pharmacological management of obesity, which is a lot of what we discussed today regarding the different options as far as semaglutides, liraglutides, and so on and so forth. And even the medical nutritional treatment programs, helping your patients understand that this is more than just the medication side of it, but also has to do with their lifestyle changes, like their dieting and their exercise, and incorporating those lifestyle changes to make sure that this is something that improves their betterment of health for a longer period of time. These are a couple of the things that you're going to learn and touch on in our medical weight loss course. And as you can see, some of our colleagues have already taken the course, and they've talked about how this course is a must-have for before considering obesity services. And then it talks about how they've learned so much and they've grown so much as clinicians due to the medical weight loss course. So I just want to put that in you guys's heads and just allow that to really resonate there in how you can really become a better clinician using the course that we have here being offered.
We have a few questions in the chat. The first one coming from Donna stating, for patients with multiple psychiatric meds, how are we going to address that in their weight loss journey?
That's an excellent question, Donna. So with the psych mental health medications, and most of them does induce weight gain. I would suggest that, again, collaborating with a psych mental health provider would be really helpful. And some of the medications that these patients take, of course, this is a chronic, chronic meds that they have to be on. It might be a good idea to say, okay, well, how can we work together? So you and the psych mental health professional, how can we work together? Because this patient is trying to lose some weight, and I'm here giving them the GLP-1s and they're getting the shots. But is there a way that we can maybe switch some of his medications that cause a lot of weight gain? So we have the different, the first and the second generation antipsychotics, especially the first generation that does come with a lot of side effects. It might be a good idea to say, well, can we switch this to maybe a second generation that does, does not induce as much, weight gain. So again, what I'm just trying to say, Donna, would be that, making sure that you're in contact with the psych mental health provider that is prescribing those medications, and hopefully cutting back on the medications that cause a lot of weight gain. Now we have newer medication, psych mental health medications that are out in the market. Can we maybe switch those out? Okay, does that help a little bit? Does that answer your question, Donna? Yeah. So, and of course, this patients, they just have to, they definitely want to leave a good, quality of life and all of that. And we coming as providers, really just advocating for them to say, okay, well, is there something that we can do together? Okay.
And we have a question from Michelle stating, do you have any tips on getting prior authorization approvals for GLPs?
Okay, that's a $1 million question, Michelle. I actually do have patients that, we're not able to get the prior authorization. The only thing I can say would be, you have to make the case for the patient. If the patient does have, let's say, comorbid conditions like diabetes, then, doing that, I know you have to do like a peer one-to-one, before the prioritization, it might be something that you want to consider to say, okay, well, this patient, we've tried everything that we can. Now they're on insulin and they're even gaining more weight, and just making the case for that. But again, remember that you have other medications, especially if the patient's insurance would not cover. So you can try the Contrave. You can start with the Orlistat to say, okay, well, is there a way that we can start, or even the phentermine, if the insurance will cover. Another thing that comes to mind, Michelle, would be even if the patient's insurance, and you can work with the patient's insurance, because we've done this prior to now. So it's something that you can kind of think about to say, okay, we start maybe with a Contrave and see how the patients go. Sometimes that's what the patient is waiting for. Let's try something else. Well, that didn't work. Now we can up the ante and do the GLP-1. So again, try to work with the patient's insurance and see how that goes. Okay, hopefully that answers your question, of course.
Suzanne wants to know, do we need to do an EKG with GLP-1 agonist?
Not really. So, EKG though, because what are you worried about? I know with the phentermine, we typically would get a baseline for the patient, but not for the GLP-1s. Can you tell me a little bit about your thought process with that, Suzanne Talk? I say Suzanne, I'm like Suzanne Talk. Suzanne, can you tell me what you're thinking about with EKG? Because again, the EKGs would be necessary for, let's say, your phentermine that we know that will cause some arrhythmias. Again, that's why it's a Schedule 4 medication. The GLP-1s really do not. I have not seen, and if anyone has seen some palpitations or some, cardiovascular disorders related to GLP-1s, you can definitely put that in the chat as well. But I have not personally seen that.
While we're waiting on Suzanne, Jesse wants to know, can you elaborate on microdosing when utilizing GLP-1s in the plan of care? Do you recommend this? If so, where would you start and how would you titrate?
So that's an excellent question, Jesse. So remember that with your whenever it is that you're starting this patient, you definitely want to start at a low dose. So what I've done in practice is that you start at the lowest dose, and then I have the patient come back in 2 weeks. So I'll say the first month we do every 2 weeks, and then after the first month, the patient has stabilized. In the next, 4 to 6 weeks, then we can start doing every 3 to 4 weeks to say, okay, well, if you're maintaining your weight loss, of course, the patient is also weighing themselves, sending you the weight, so that again you know that this is a sustained weight loss that the patient has. Then of course you may want to get the dial up the dose a little bit. So again, it has to be in small increments. Remember, we talked about the GI side effects. That's really important that we're keeping an eye on that, so that these patients don't quickly get the gastroparesis we talked about. Okay.
Sunset asks for your thoughts on patients seeking compounded GLP-1s.
Yeah, so compounding GLP-1s, I want to make sure that you're aware of it, and we have it in the course. We talked about it in the course that compounding GLP-1s are not FDA approved. Again, if you really want to make sure that you are doing right with your patients, then I know I see a lot of nurse practitioners that own their own practice doing the GLP-1s, combining with, other medications, vitamin B12 and all of those things. But the compounded GLP-1s are not FDA approved. So you want to know that. And you definitely want to make sure that you're on the right side of the law. So you can actually Google right now providers that have gotten in trouble with compounding GLP-1s, because again, the FDA are really after this provider. So I would say just prescribe the GLP-1 how FDA has approved for it to be prescribed, and weight loss and would always go hand in hand with lifestyle modification, like your diet, your exercise. And in the course, this medical weight loss course, we went into a lot of detail about the fat diets that you have out there and the ones that really would work. So again, the commercial diets, and maybe going through your dietitian and really working hand in hand with your dietitian. So hopefully that answers your question.
We have a question from Mia saying, in regards to compound medications, is it better options of getting approved she has recognized that many do not prescribe.
Yeah, I think I see Maya here saying understood Mia. So again, remember that compounding medication is not FDA approved. FDA is actually really hounding providers that are compounding medication. So we have to be real careful with that. Okay.
And Yolinda wants to know, when do you seek clearance from endocrinology prior to starting GLP-1 medications? For example, thyroid modules on us without prior endocrinology evaluation.
That's an excellent question, Yelena. So remember that if a patient comes in with a thyroid nodule, you're getting that ultrasound. You may be needing a final aspiration to assess if the nodule is a hot nodule, cold nodule. And of course, if you determine that this patient has a nodule that is malignant, then that's not your patient anymore. And you're definitely not starting them on GLP-1s. So when do you seek clearance from endocrinology would be, and that's a good thing to do if a patient has a nodule that is, let's say, is not malignant, it's just a benign nodule, I would definitely be in touch with the endocrinologist to say, okay, well, do you think this patient is a good candidate? So again, seeking clearance with endocrinology does save your license, saves you as a provider. That okay, and you definitely want to document that very carefully. Okay, very
We
nice.
have Suzanne asking, Suzanne said she was curious because some patients experience an increased heart rate taking Ozempic, and she normally prescribed Phentermine in the past. Why she's
Right. Yeah. So again, it just depends. And that's a good comeback. So it depends. If a patient already has, let's say, some, cardiovascular disorder, they have CHD, they have, they've had an MI in the past and whatnot, then of course you may want to get an EKG just to make sure. But again, with those type of patients, I would not handle them just all by myself. I definitely would have some cardiovascular, the cardiologist working together in tandem with a cardiologist with this type of patients. Okay.
And Valerie has said, if a patient has reached their goal with the GLP-1 and we titrate the patient off, but they begin to gain the weight despite maintaining lifestyle changes, can the patient get on a maintenance dose of GLP-1?
Yeah, as long as the insurance covers that, Valeria, that's really the main thing. And that's why you're teaching this patient about, maintaining your lifestyle changes, and maintaining a healthy weight is also important because again, once a patient learns that it's not just a medication that is helping me lose weight, but my exercising, my, watching what I eat, and no emotional eating, those things are really important. Okay.
Michelle has asked, how early do we tell patients to hold GLPs prior to colonoscopies?
So again, this will be a question for your GI, because they're the ones performing the colonoscopies. So remember that typically the GI, they're wanting for you to come in and do a pre-op for the patients that are going in. So again, I would say, Michelle, just go ahead and ask the GI specialist to say, okay, well, this patient will be coming in for the labs and all the things that you want for me to do just to pre-op them. How long do you want, or how early do you want them to hold the GLPs before colonoscopies? And I'll say about a week or so, less than a week. Not as is not as I'll just say, collaborate with the GI. That would be my answer to that one. Okay. All right. Okay, so most of what the questions that you all asked, and these were really excellent questions tonight. And hopefully we did answer your questions. But I wanted to just give you a chance to, again, if you're wanting to learn more about including the medical weight loss to your practice, because that's what some of our, and I'll say most of the nurse practitioners that are taking this course, they really wanted to be sure that they're doing things the right way. I've see courses out there that say, well, you can compound medications. Folks, again, that are getting in trouble with that. So you have to be real careful that, when you take the CE courses, that you're also looking at what FDA thinks about it. So again, we do have this course right here. You can scan the QR code, and I would maybe let Amelia talk some more about this.
Yeah, so as I was stating earlier, our medical weight loss course is very comprehensive in its learning and its knowledge. And so it is for the betterment of you as a clinician, as a nurse practitioner, to go ahead and take the course. It does improve your knowledge, it improves your clinical skills, it improves pretty much every aspect in the medical weight loss journey. So if you do scan the QR code for our course, if you use our special offer, which is available until tomorrow at 11:59, you can get our course for 25% off for the next 24 hours using the code CE4, the number 4, me. That's CE4 me, and you can get 25% off. Also, being that it's an online course, you get access to the online course for a year. It's also auto save, and so it's very reliable. Whenever you feel like you have time in your schedule to view the course, it will pick you up right back where you left off. And also, many of the things you will learn, some of it we mentioned in the previous slide, but I'll also dive into it more here. It says we will learn the role of the advanced practice providers in weight management, obesity introduction. We'll learn establishing a medical obesity clinic for advanced practitioners. We'll learn about the pharmacological management of obesity. We'll learn about the medical nutritional treatment programs and diet challenges, the medical weight loss and lifestyle maintenance, as well as so much more in the course. It goes over multiple chapters. There are videos, there are lectures. It's very engaging, very fun, very interactive. So it doesn't feel like you're just being talked at. It feels like you're really learning within the course. Again, let's say that the price is a bit too much. No worries. Like I said, using the code CE4me, you can get 25% off. Not only that, if you can't pay it in one lump sum, then we also provide you with some monthly payments. We have payment plans that are also available for you as well. Are there any questions regarding the medical weight loss course?
Yeah,
Anything?
so yeah, there's something I just wanted to add on, and this is a question I get all the time. So we did include the telehealth option. So again, the course also talks about, how you can include medical weight loss it's your practice using telehealth. So the patients, once you see them the first time, they can follow up with you, via telehealth that they don't have to come in every so often. So that's another way that you can hopefully, help the patient so they're not there in your practice every 2 weeks or every 4 weeks when you have to titrate the medication. And then another thing would be, of course, that motivational group goal, a group of weight loss weight loss groups. I've seen that really works very well, where you have, some patients that they all join a group and, they meet together. You don't have to also be involved. You can have maybe one of your staff kick that off, and then it has to be patient led, where they're talking about, okay, well, what are we doing now? How much weight are we losing? How are we exercising? So that group meet is also something that you can include in your practice for patients to really, of course, they really love that as well. So yeah, there's just a lot out there. Again, I want for you to be sure that you're knowledgeable about how to move forward. And yeah.
Yeah, and in addition to the medical weight loss course, we also offer so many other courses on our website as well. I know earlier a lot of you were mentioning family practice, which we have a course for that. Also, one of our fan favorites, family practice ready course, is very comprehensive in its knowledge as well. Some of you mentioned HRT, that's in our women's health practice ready course. So that one's also available on our website. And our urgent care practice course is our top seller. It is the one that people rave about the most. And I feel like it is because we also give you a 1 hour suturing, instructor-led suturing practice, where we ship over suturing materials to you. So you have a suture pad, you have the nylon, you have the needle, and the thread, and all of that is allowing you to have hands-on practice in addition to the online learning as well. All of our courses include videos, they include lectures, they include free downloads in some of them as well, some cheat sheets for different things that you might need to know. And so they're all very comprehensive in their knowledge, very good with being just thorough and in depth with the information, but also presenting it to you in a way that's palatable, in a way that's easy to understand. And like I said, we've had many people who have gone through the courses and have talked about how they have truly been a testament to their practice. And now they're so grateful that they went through with some of these courses so that they can become better.
All right.
We have a question from Yolinda asking, does the course cover lever of billings and documentation, office notes for weight loss?
So yeah, it does. It talks about billing for weight loss for sure. Because again, the way that you bill for weight loss is a little different. So it does cover the documentation and the billing and codes for weight loss. It does. Okay, any other questions? It looks like I'm seeing some other questions. Any questions about anything we've talked about tonight, or even the course itself, or any course that you're interested in? I know the Family Practice Ready course is also one that is very popular. It does provide you with quite a bit of CE hours and RX hours. Okay.
Thank you. And you made it to the end. We want you to remember that the medical weight loss course would be of great value to you and to your patient. As a thank you, we have a special offer that is from now until tomorrow at 11:59 p.m. Use the code CE4ME to get 25% off. Don't miss out. It's an opportunity to invest in yourself and your practice. The course you previewed today, along with many of our other courses, are designed to strengthen your knowledge, boost your confidence, and give you practical skills that you can apply right away. In patient care, we want these resources to truly support you, not just today, but throughout your career as a provider. So please drop your first and last name in the chat and your email to receive your CE credit.
And thank you all so much for enjoying this evening with us. We are very grateful that you guys came through. We are hoping that it was very insightful, very knowledgeable, and we will be getting you guys those CE credits.
All right, so I'm getting all the names and the email addresses. So hopefully, Kiana, hopefully you're getting those as well, because yeah, you will be receiving your CE credit for being so patient and just waiting till the end. Are there any other questions about anything else that anyone has about any of the courses? For those of you that are interested in the family practice, you can also use the same code for 25% of the Family Practice Ready course or the urgent care course. So it's not just the medical weight loss course. Okay.
I see a lot of thank yous. Erica said it was great information.
Very nice. Very nice. Okay. Well, I know we're on top of an hour almost, 1 more minute. So we have one more question to go. Then we can kind of take that and round that up for tonight. Any other questions, comments, anything else that you'd like to know, or about not just this course, but any course at all? Okay, very nice. Thank you all for showing up. Again, just remember the code. You still have till tomorrow. So if you want to, think about it and all of that, then feel free to reach out to us as well. Okay.
Yeah, and you guys can always contact us through either phone or email. Feel free to not just have to speak to us in the chat as we are about to leave, but feel free to reach out to us through email, call our office. We will be happy to help you. And again, all of our resources are on our website, so just go ahead and visit there as well. Thank you guys so much.
All right. Thank you, guys.